Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Labostix International. This audio podcast is part of Sonar and Critical. This audio podcast is part of an Interstellar and Rampage. This audio podcast as part of a Storm Labostix production. Through this audio podcast today, a look at the sort of background and rationale in around some projected works. So in the in the United Kingdom, the CKD prevalence was reported as 1.24 1.240 1,240 per million population overall in the adult population, but ranged from 144 to 2,497 per million population across different national health services, renal services, and around renal services particularly. There are also differences in the ages and distribution of chronic kidney disease or CKD chronic kidney disease stages between different specialist centers. The 2021 prevalent CKD adult population comprised of just over 21,000 recipients with a median age of just over 77 years, compared to the median age of in around 59 or almost 60 years for those on different forms of kidney replacement therapy or KRT. There are now differences in that. There have also been differences in the ages and distribution of disease on stages between different sort of centers. Historically, there have also been discrepancies in the different the definitions used for the processes of care or reporting of chronic kidney disease between centers. At the same time, an absolute subgroup numbers are and as sorry at the same time as absolute subgroup numbers or cohorts are small in pediatric and young people population. Caution tends to be required in thus in aspects of comparative in aspects of comparative analysis. There were 196 recipients under the under the ages of 18 years when who commenced different forms of KRT or kidney replacement therapy in around in amongst and across the different pediatric or children and young people kidney services in around 2022. When adding between different KRTs or kidney replacement therapies, again the absolute number is varied. Most patients at the same time, and the majority are treated with the KRT referred to as peritoneal dialysis, just under 80%, and the high number of recipients had received what's known or referred to as a live transplant, and were in the age range between 4 years of age up to just under 8 years of age. This contrasts with children and young people in the same age bracket who had received cadaveric or brainstem dead donors, or in brainstem dead donors in around 18 or just under 20%, around 18.4%, and then 40 just under 50%, or 48.1% within the 12 to just under 16 year age population had received received a live transplant. And so again, the analysis varies, between children and pediatric healthcare and adult healthcare services, since the children, young people population in context of chronic kidney disease and other conditions are a sort of are a minority population, although whilst they are a minority population, the challenge in across in as what has been it has been documented in amongst literature and amongst evidence, is that children and young people with chronic kidney disease and chronic kidney disease and other conditions, is that they tend to have to live with the sort of anomalies and challenges much longer than in amongst the adult cohorts. And so again, the analysis in around some of the aspects pertaining to sort of healthcare services and healthcare services for children and young people in amongst kidney services, again, is a variable, not just in between, for example, in the United Kingdom, but in other parts of the world, also. So that draws this audio podcast to a close. And this audio podcast is part of the Labostix International. This audio podcast is part of a Sonar Critical. This audio podcast is part of an Interstellar and Rampage. And this audio podcast as part of a Storm Labostix production.